How to use the PAR-Q in risk stratification by Mariah Lipke. What is risk stratification? A method to initially classify clients as being at low, moderate, or high risk for coronary, peripheral vascular, or metabolic disease. This gives the personal trainer a chance to look and find a starting point in identifying an appropriate program for each client. It also lets the personal trainer know if they need to get medical clearance before the program starts to ensure the safety of the client. PAR-Q, Physical Activity Readiness Questionnaire. This is a tool developed in Canada. It's cost-effective, easy to administer. It helps see which individuals need additional medical clearance. It does not exclude people that would benefit from low-intensity activities. The purpose of this is to give the personal trainer an understanding of the readiness of the client. It also gives the personal trainer a first step in determining risk stratification. PAR-Q can identify a positive coronary risk associated with the following: sudden cardiac death, CAD, which is coronary artery disease, orthopedic concerns, recent operations, existing diagnosed pathologies, any medications or supplements, a personal history of suggested signs and or symptoms, and lifestyle management. PAR-Q. This was what a general PAR-Q assessment form would look like if you had your appointment with your personal trainer. It's just answering some questions about your history, basing off your lifestyle right now. Risk stratification. The risk stratification process uses age, health status, personal symptoms, and coronary risk factor information to put each person into a classification of risk strata: low, moderate, or high risk. This is just a page from our book showing risk stratification process criteria. This is where you would look to see what type of classifications or processes you would have to go through to get the okay for a possible exercise program. This is the categories of risk stratification: a low risk, moderate risk, or high risk, depending upon what you answered on the PAR-Q questionnaire and what your doctor gives you the clearance to do. Questions and results. Answering yes to any of the questions should be referred to their family doctor for further evaluation to proceed with any sort of exercise program for your safety. Answering no to all of the questions, the client is ready to go forward with the next step of evaluation to proper workouts and activity. Client 1, which would be a low-risk person. What types of exercises? Generally, you do 3 to 5 minutes of warming up and jogging or active stretching to get the muscles ready for a workout. You would then do 35 to 40 minutes of different resistance and cardio-based exercises to get the client's heart rate to a proper level for work. And then followed by 3 to 5 minutes of cool down, such as a slow jog, to do just that. Cool down the body, bring the heart rate down to a safe level, and then administer 10 minutes of stretching to cool the body down more and keep the flexibility throughout the muscles that you were worked. Doing something like this 3 to 4 times a week would be ideal, with some low impact exercises in between, like yoga, just so you can keep your flexibility. Client 2 would be a moderate risk. Of course, since you're going up in a risk factor, you would raise the warm up, maybe at a little bit of a slower pace with some extra minutes of warming up and cooling down, with 25 to 30 minutes of modified exercises that the client is able to do with slight assistance and clearance from their family physician for certain workouts. Keeping in mind that if something doesn't look right or safe for that client, do something else in that place that would be better for the client. Then, of course, cooling down the same amount of time as warm-up. few more minutes if you need. The last step is stretching out the muscles that were used, maybe doing that 2 to 3 times a week with an okay from a physician. And then client number 3, which would be a high-risk client. This would be a one-on-one medically supervised workout program. Warming up, which would be until the physician says or states in the release that it's okay for the client to move forward with the rest of the workout. Any sort of these workouts would be listed on the release form by the doctor, depending on what was given, would be what the client was able to do. The time limit would also be set by the doctor. The cool down would also be listed by the doctor to follow until further notice. Most important, the workout would have to take place somewhere that would be readily available for emergent care, depending upon what the client kind of risk factor they had. Did they have any surgeries, or did they have open heart surgery? There's different factors that would come into what the doctor would want you to do. Of course, how many times a week, if more than one, would be listed on there as well. So for client number 1, which was a low risk, it would be unsupervised, maybe meeting with a trainer once or twice a week. Client 2, moderate risk, meeting with the client 2 or 3 times a week to make sure that they're properly doing the workouts and not pushing themselves too hard. And then client 3, which would be high risk, which would be a one-on-one supervised medical workout.